This topic is patient-controlled analgesia, or PCA. PCA refers to a method of pain management that allows the client to self-administer fixed doses of opioids. Most often, PCA refers to the actual device or pump provided to the client that delivers a set amount or demand dose of IV analgesic every time the patient presses the delivery button. There are other forms of PCA medication delivery, but we'll discuss those on another slide. The benefit of using PCA is that the client has control over pain management, and this allows for more optimized pain relief. PCA management is typically reserved for conditions that require a constant and substantial amount of pain relief. This is often used for postoperative pain management and may be prescribed for clients who have painful acute or chronic conditions, including cancer, sickle cell crisis, or for those who are in active labor. Administration routes for PCA include IV and epidural routes, as medications administered by these routes will be used and metabolized quickly by the body. And opioids are the most common drugs that are administered through PCA, including morphine, fentanyl, and hydromorphone. To set up a PCA device, necessary equipment includes IV tubing and an electronic PCA pump. Some PCA pumps might be individual devices, while others might attach to pre-existing IV pumps. When the PCA is being used by the client, the device must always remain locked to prevent misuse. A PCA medication syringe that contains the prescribed medication is usually obtained from the pharmacy and may require a sign-off or second witness to not only verify the medication, but the dose or rate that the medication will be delivered. Lastly, continuous IV fluid is often prescribed to keep the vein open and flush the medication through the tubing. This ensures the medication actually reaches the client. A PCA device is typically programmed to deliver medication in a variety of ways. For some clients, the healthcare provider may prescribe what's known as a basal dose. This is used to deliver a specific dose of medication continuously over a set period of time. This method allows for continuous pain relief and establishes a lower baseline overall for the client's pain. Demand dosing is another method of PCA use. In contrast to basal dosing, the client is able to self-administer a dose of pain medication as needed, typically by pressing a button. Doses are typically much smaller than we would give scheduled or as needed, usually in the tenths or 1/100ths of a dose. And this is given on a dosing interval. What this means is that even if the client pushes that button over and over and over again, they will only receive a dose when the dosing interval has passed. For example, a client may be prescribed to receive 0.2 milligrams of hydromorphone every 10 minutes. Regardless of how many times the client pushes the button, they will only be able to receive a second dose of 0.2 milligrams once that 10-minute interval has passed. Demand dosing uses a maximum lockout for pain medication delivered over a specific time period, typically over an hour. This means that the client can only receive up to a certain dose of pain medication every hour, which helps to prevent accidental overdose. The last type of dosing option for PCA management is a bolus dose. If the client has basal or demand dosing already prescribed, but is having inadequate pain relief due to a sudden change in pain, the nurse can access settings on the device to deliver an additional dose of pain medication. Often, this type of bolus dose is used to help get the client's pain under control and reestablish a baseline, which may be necessary if the client has fallen asleep and has not pushed their button for some time, or has undergone a rigorous treatment regimen. When caring for a client using PCA, nursing interventions include ensuring the proper medication and dosing is programmed into the pump, which will help prevent under or overdosing the client. Monitoring pain levels on a regular and as-needed basis to determine whether the PCA is providing adequate and appropriate pain relief. Monitoring and maintaining the IV site to make sure medication is being delivered into the vein and that the catheter has not displaced. Monitoring the client's level of consciousness and sedation to prevent medication overdose. The Pacera Opioid-Induced Sedation Scale, or POSS, is one method of monitoring sedation. We'll talk about this more on the next slide. Often, it's a good idea to set up and monitor continuous pulse oximetry, especially since opioid medications are known to cause respiratory depression. And a reversal agent, such as naloxone, should be made readily available in the event of an overdose. After PCA use, the leftover medication should be documented and wasted according to hospital policy, which often requires a second nurse to witness the waste. The client should be educated about proper use of the PCA device. For example, only the client should be allowed to press the demand button. If a family member or friend pushes the button for the client, this could lead to excess sedation and accidental overdose. If the client is the only one pressing the button, remind them that overdose is unlikely with proper PCA use. Lastly, fall precautions should be implemented for clients using PCA, as strong pain medications can affect a client's proprioception, which could lead to a fall injury. Our last slide takes a closer look at the POSS. This scale gives us an idea of how drowsy or sedated a client may be while taking opioid medications and expected nursing interventions based on the client's presentation. For example, a number of 1 means the client is awake and alert, which requires no necessary action by the nurse, and the nurse may even consider additional pain management if it has been prescribed by the healthcare provider. In contrast, a number of 4 means that the client is somnolent with minimal or no response to verbal or physical stimuli. This means that if you are loudly speaking and trying to get the client's attention, as well as performing any noxious stimuli such as a sternal rub, the client is still not giving you any kind of response. In this instance, we should immediately stop administration of any opioid medications, consider administering naloxone, notifying the healthcare provider, and monitoring or intervening on behalf of the client's respiratory status.